Hi all, Dr. Raman Sakhuja here, consultant psychiatrist and a professor of psychiatry with the University of South Wales. I make videos on my channel on common mental health topics and give you some tips to manage them, and also to inform you of the services available right here in Cardiff. So, what is the topic for today? The topic of today is on social anxiety disorder. And social anxiety disorder is an anxiety disorder that is now recognized as a chronic psychiatric problem with considerable functional impairment. It is, in fact, the third most frequently occurring disorder after depression and generalized anxiety disorder. So, what exactly is it? The essence of the disorder lies in the fear of being scrutinized by others, which leads to fear of humiliation or embarrassment in social or performance situations and leads to avoidance of those situations. Due to the fear response, there may be somatic symptoms like flushing, twitching, stammering, or muscle tension, GI discomfort, palpitations, and the like. There may be behavioral symptoms such as avoidance of those situations. The avoidance symptoms are often the greatest source of impairment and can range from subtle ones such as avoiding eye contact to complete avoidance of all interpersonal contacts outside the immediate family members. There are certain clinical subtypes. The first one is generalized or diffuse social anxiety disorder. What happens in that is there is fear of most social and performance related situations. The other one is non-generalized, where the fear response is limited to 2 or 3 social or performance related situations. People often ask, is it not just simple shyness? Whilst this disorder may come across as an extreme form of shyness, one key distinguishing feature is the level of functional impairment. The individual with social anxiety disorder often has an impairment of functioning in various aspects of their lives. What else is important to note? It normally starts in mid to late teens. However, the mean age of onset is in late 20s or early 30s, which is roughly a decade later after the onset. Females are more often affected and are about 1.5 to 2 times more likely than men to have it. It is often comorbid with other mental health conditions. How do we manage it? CBT, either individual or group-based, can be very helpful, and different medications that are effective in other anxiety disorders and are often very helpful. Most commonly, a combination of medications and psychological interventions are needed. So if any of you, your friends or family suffers with social anxiety disorder, my suggestion would be to go and see a qualified professional who would be able to help you understand this, formulate a plan and manage it. And if you have found this information on this video useful, then please like, share with friends and families, subscribe to the channel and press that bell button icon so you get notified for all the upcoming videos on the channel. Thank you very much and see you up until next time.